forgetting to record. I've done that before on a review. It's very difficult. Then I have to go back and voice over myself. Anyway, this is exam 1. It's going to encompass chapters 26 through 35. It's a lot of chapters, a lot of information. So we did make you a PowerPoint study guide. I know that these exams are covered in here in some manner or form. Also, these are great to use for your HESI, hint, hint, hint. Those concepts you'll see there. So if you're studying something, you didn't see it, well, I bet you it's going to be on the HESI. So go back and look at these for that. It will help you in the long run. I had all your professors, hopefully, did post all Kahoots 1, 2, and 3, which has great concepts that are in there. If you know them, know how to apply them in different ways, you'll be good, because you'll see similar concepts on the exam and your HESI. So these are something you should be reviewing as you go along. So exam 1, of course, let's go right into the theorists, right? The theorists, I think, are the most difficult for y'all to understand. I want you to know that the last HESI had 4 questions on theorists: Erikson, Piaget, Kohlberg, so and Freud. So for you not to understand it, you'll be missing lots of points. So let's see if I can make it understandable for you. Erikson. There are different levels according to infant, toddler, preschool, school age, and your adults, your adolescents. So let's look at trust versus mistrust. These are your infants. What does that mean? Well, an infant who trusts knows that when they cry or call or coo or whatever they do for their mommy, when they're hungry, they're wet, they're tired, need burps, just want them, mommy comes, they trust you're coming. That is the trust we're talking about. So these children are what? They're happy, they're content, they know their needs are met, and they know that they're going to get them met with, their caregiver. Mistrust is when they don't know that you're going to come. You cry, 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 cry. And due to whether it's a parent who, doesn't have time for the child, or too many children, or whatever, they don't come. And these children end up to the point where they've cried so much they don't cry anymore. So it's pretty sad to see an infant like that, because it's not normal. Now, when we talk about toddlers, autonomy versus shame and doubt, and you need to know what these conflicts are: trust, mistrust, shame, and doubt. You need to know what belongs to what, okay? So shame versus doubt is when you have a toddler, they're exploring the world and they're trying new things. And many parents like to go and do it for them and don't let the infant do, or the toddler, or they go and they say, no, stop, you're going to hurt yourself. The thing is, when you don't allow a toddler to be independent, they're going to go into the feelings of that doubt. Can I do it? Am I able to do it? And you want to push a child at every age to be what all they can be, like be all you can be in the Army. Same thing with the toddlers, okay? Now, when you go up to preschooler, it is now they go out and they're building their self-confidence and they are starting to be able to make decisions. But when we're talking about that, they're also guilty when they can't do things. The next one, which is an important one, is school age. Industry versus inferiority. So what is that? Well, industry is what a school-age child does well. There's school-age children who do sports well, or they swim well, or they spell good, or they math they're good, or they write well, or they color good. So they can master a task well. That is industry. What they can do good, and they are praised for what they do good. Inferiority is things that they can't do. You have children that are good at sports, they're terrible at schoolwork. You have children great at schoolwork who can't run around and they fall. They're terrible at sports. So that is the industry and the inferiority on a child. And then when we get to the adolescence, this identity versus confusion, it's that identity thing. So you become an adolescent and you're was a kid, and all of a sudden you have to be more of an adult and you don't know who and what you are. Do you like women? Do you like men? Do you like both? Do you like none? That's just a relationship. Then what peers do I want to hang with? Is it the music crowd, the band crowd? Is it the sports club? Is it the smart kids? Is it whatever? They need to find who and what they are. What am I going to be when I, quote, grow up? And finding direction, looking for their identities. Makes sense now, doesn't it? Now, Freud is all about sexual things, and he talks all about oral and anal and phallic. But the one that you need to know about is children, the infants. It's what Freud talks about a lot. And it is that Freud says that an infant explores the world through its mouth. We know that they're given pacifiers because they can self-soothe and they can de-stress themselves with it. That's the feeling about pacifiers. So, and the oral thing, you see babies even up to 3, 4, 5 years old, everything in the mouth is what they're doing, is exploring through the mouth. So, and then it goes into the potty training. Then it goes into, they like moms, boys like moms and girls like dads. And then it's more, but it's that first stage it's most important that we talk about Freud. Now, Kohlberg. Kohlberg, just a general, is there's good and bad and a consequence for it. And as you get older, you're able to manipulate and understand the values of the crowd to understand what their good and bad is. Because initially, it's all about the family. So the family good and bad are different than another family's. And we know that. And they start to get that as they get older. So Kohlberg, good and bad consequence for them. And then as they get older, they understand the general population and what that's all about and how to conform and to fit in. You can always go under Maslow and look at the whole thing, with the pyramid thing, but this is all just Kohlberg again. Okay, play. Play is so important with children, and there's different sorts of play. So the onlooker is they just look and see what you're doing. Solitary, they're sitting alone playing with whatever. Parallel, they're children all over, they're playing, but they're not together at all. Now it gets to the associative companion play. Children are sitting there playing with their toys together, but it's unstructured. They're not playing for a goal. They're not working as a team, and that's associative play. Now, when you go to cooperative, this is when two children get together with a goal and they work together to get it. A great example is checkers or playing cards or a board game. That is absolutely cooperative play. So play is great. It uses their creativity. It helps them muscles, using them back and forth, dexterity. It helps with them thinking, and it gives them comfort as they're doing it. And it's great for development. So the quicker the child plays, they start with the reflex palmograph. They go, now they're a voluntary. Now they're playing already. And that's usually by about 5 to 7 months. And you can put rattles back and forth. Now, therapeutic play is a little bit of difference. It has to do with a child in a hospital who's gone through an event or is going to go through an event, and we're teaching them about it so that they're not going to be afraid. They can see what's going next. We talk. It is today, which was great. And I remember when they came into fruition in our hospital, it was about 2008. Wow. I lost you. All of a sudden I realized it. We were on therapeutic play. Okay. Thank you
Yes.
guys. Woo! That's crazy. Yes, no, shake your head. Okay.
We can
So,
hear you now.
all right, great. So allergies. You know, one of the first things we do when we have our admissions is to do an admission history. And one of the questions is, do you have any allergies? And many children, and of course adults, when you get there, they do have allergies to many different things. Now, the most priority question to ask this person, the patient, or if they're old enough, or the parent, is tell me what happened. What was that reaction? Because sometimes I have heard things like, oh, my child's allergic to albuterol. And I said, so what happens? They go, their heart beats fast. Well, we know albuterol makes the heart beat fast. But if they say their throat closed up and they started swelling and choking and they went into anaphylactic shock, that's a different way to treat the allergy. So very important first question. And then we go into, was it over the counter? Was it prescription? How did you take it? Was it in the hospital, IV? Was it PO, IM? When did it happen? And then who told you this was an allergy? Or do you think it is? Did they take it again? Many children, they give it to them again and they were okay. And of course, do you tell the doctors about these reactions? Because they're important that we let them know every time. You have an allergy, let them know. Now, cultural differences when doing a history and physical. You know, we think of culture, you know, we know who we are and the people that we know. But if you have a culture you don't know, you need to ask the parents, what are some stipulations that I need to know about your culture? It could be diet, it could be how you treat that child, it could be you can't have a male nurse with a girl, it could be you have to always provide privacy. I mean, there's all different things. Now, if they're an adolescent, you can ask the adolescent too. You don't have to just ask a parent. If they're old enough, they can tell you. So you're going to ask to so you can be able to treat this child the best you can. I mean, I'm in a culture of Miami who's like so many cultures. And, you know, I came from this little town in New York where there was not even a Spanish person up there. So, I mean, they were all just American people. So I grew up, came to Miami, knew nothing. How did I learn? I asked questions. And I want you to know that I got so much respect for doing that, for asking. So you can find about their food, their staff, as I said, the female cultures, and then not disrobing for a complete examination. You could just uncover a piece of something. And always ask questions you don't know, ask. It's the best thing. So assessing the child, there's histories and there's physicals. Be careful. Physicals are stuff you can see and touch. Okay, it's vital signs, it's height, it's weight, it's head circumference, abdominal circumference. It is listening to the body itself. Now, the history is what happened and how they got there. Completely different. So know the difference between a history and a physical. Now, growth, growing up. I see nutrition here, right? Nutrition, 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 nutrition. What is nutrition? It's fuel for the brain, it's fuel for the body. You know, proper nutrition that these children are going to grow and developmentally grow the way that they're supposed to. Now, the thing that we measure nutrition is with weight, right? That's why every time you go to the doctor's office or into an ER, urgent care, what do we do first with a child? We weigh them and we take their height. We compare it to the last one. By 6 months, they should double their weight. By 1 year, it should be tripled. Now, let's say they were born at 6 pounds and it's 6 months and they're only weighing 9 pounds. There's a problem. This is a failure to thrive. This is lack of nutrition. So then we have to give some more nutrition, whether it's increasing the calories or increased feedings. And then if it's too much, well, maybe we need to slow down a little bit. So this is our guidelines to help take care of our children. So frequent assessments in childhood, we've learned all of these things. When they sit up, when they roll over, when they crawl, they pull themselves up at 9 months of age. Well, what if they're not moving forward in this developmental sequence that they're supposed to grow up? Well, if they're far behind, what we can do is institute what we call early intervention. Well, what is early intervention? Well, it's getting that child those therapies that they need, like physical therapy, occupational therapy, speech therapy, and all of those working can catch a kid up so quick. So frequent developmental assessments are important because we can see those delays. Now you're going to listen to the belly. Part of the assessment is first you look at it. What does it look like? Is it distended, round? Is it concave? Is it flat? Is it ripply? There's going to be all different things you can look at. Then you listen to the bowel sounds. You go each quadrant separately. And then percussions, you're going to be looking for all different things, fluids, masses, and then you're going to palpate, feeling deep, seeing where things are in there. Cardiac assessment, I was telling my class yesterday that this is one of the things they have in capstone, and we bring it back here in pediatrics, to reinforce our health assessment. Where do you find different places in your heart to listen to those valves? And this is it described right here. There's a pretty picture to your right, and this is a description on your left. The aortic valve is the second intercostal space on the right side. Pulmonic is also on the left side of the sternal border on the second intercostal. Mitral, the fifth intercostal space mid-clavicular line. And tricuspid is now the fifth right and left intercostal space close to the sternal border. So if we want to listen to the heart to see if there's a murmur, or if we listen to the heart and hear, and we hear this clicking and stuff going on, we can go to each valve and we could say, that sounds like it's the pulmonic valve, or that's the aortic valve. And that's going to make a difference in the way you care. Is it a murmur going to the lungs, which could occlude, which means you're not getting enough oxygen? Or is it that aortic valve going to the body? Is that blood pressure still okay? So there's many things that we know by looking at valves that you can take care of your children. Breath sounds are important. Kids are pretty tricky. They have a lot of this upper airway mucus that can be referred sounds into the lungs. So we have to make sure what we're listening to is true and real breath sounds. So bronchial breath sounds are heard over the trachea. It's right at that notch between those two little bones in your neck right there. And you can hear bronchial breath sounds. And what does that mean? This is upper airway. This is nothing like rales or rhonchi. Children get all these boogery nose, right? I would also listen in the cheeks in some kids, right underneath their necks, because I could hear the same sounds there. So if I heard those sounds down in the breath sound area, like over the vesicular sounds, I know that this is clear down there, but it is upper airway type of secretions. So different places, different things to look at, but I wanted to describe that one to you. So car seats. Car seats are incredibly changed. I actually sort of remember looking at that little metal box there. I think we had one of them growing up. And it looks like the car we had too. I'm sort of showing my age, but they did start to have those things. I think it was with my little brother. Now, the thing with car seats, we know at birth, they should be rear facing and they should be in the back seat. That's where they need to be for the first 2 years of life. Now, choosing your car seat, how would you choose a car seat? Well, you're not going to choose one that doesn't have a date on it, that you don't know what it's about, or you're not going to choose one that's old, because you need new car seats. And you always place it rear facing in the back seat. There is a whole thing on car seats, with the Grocco baby there, we can look at it, but car seats do expire. I mean, right now it says 6 to 10 years, but we know that they are getting better with making newer and newer ones, every couple of years. So checking the dates and checking that information for a new mother would be good. Also, I know many children's hospital will show you how to properly install your car seats. They have these Saturdays, like once a month, that they have the staff members doing it. Now, when we talk about the adolescent, the first vaccine that they are going to get is the HPV, right? This is the STD's type of vaccines. Hep B is given at birth, right? Hep B is given at birth, and then it's given 1 to 2 months later, and at 9 months. Sometimes it doesn't get given at birth for whatever reason. Maybe it's insurance, I'm not sure, but it's given at that first doctor's visit for absolutely sure. As I said, HPV is the one that's given around 9 years old, but it's usually a little bit older than we've given it, and it's 2 injections 6 months apart. And they are giving it to boys too. That's always been a question. Is it just girls or is it boys? Well, can't boys get this too? Well, absolutely they can. So now let's go back and look at the infant. So these are milestones that we're looking at. Head lag is when they're initially started, and then it goes, and then the head gets the strength, and now they can pick their head up when they're pulled up. Head lag is when you hold their 2 hands and their head falls backwards. That's at birth. Okay, you always have to support the neck. As they get older, their muscles are developing from all that proper nutrition, and now it's got strength, and now it can pull up when you pull up with the arms. They're able to sit up for long periods of time as long as they're supported. When they get to be 8 months old, it's unsupported. That's what the outline says, 8 months unsupported. They're able to run around front to back to front by about 5 to 6 months. That's when we start teaching our parents to be careful. Do not leave them laying anywhere because they can fall on the floor. It could be on the couch. It could be on the changing table, on your bed. And I've seen it. I've seen many kids, parents come in upset. They fell on the floor, cement floor, hit the side of the bed, and they're concerned and worried. So very important that we let our parents know that. When they are on their back, their feet go right in their mouth. And I think it's so cute. They can grasp their objects about 3 months. And again, Freud says everything in the mouth. That's how they're exploring the world. They say they should have teeth by 6 months, but if they don't, it's not, one of those developmental milestones. You'll see like nubs there, but you don't get the teeth up yet. I've told my classes, my kids never got teeth for the first year. At 15 months, they got 6 at a time. So we went through teething craziness as a toddler. They should be pulling themselves to standing position to be able to walk around the coffee table and the sofa about 9 months, and again, sit unsupported at 8 months. Colic. Colic is a horrible thing. Colic is gas. It usually is gone within the first year, but this is a child who is always crying, always uncomfortable, always, full of gas, no matter what medicines we're putting into them. So it usually starts about 2 weeks of age, and it maybe will go away by 3-4 months, sometimes a little bit older. But when we are nurses and we get a parent who calls, let's say the clinic or calls the doctor's office where we're working and says, my baby is crying a lot. I mean, every day, I don't know what to do. Do you have any suggestions? Is there any over the counter that I can get? Well, if you have an infant who's crying, do not assume it's colic. Make sure you get them into the doctor to be assessed, because it could be something else. There's a lot of conditions we haven't studied yet in the GI system that it could be. So don't assume it's colic. Developmental periods, sequential trends, and this is predictable. I mean, I was just talking about this. This is when we know they're going to lift the head up, they're going to roll over, they're going to crawl, they're going to creep, they're going to, walk. This is the one before the next, before the next. Sometimes we skip steps, and that's okay, but as long as we're going forward. So developmental pace, it says a child will not move forward unless it's ready to go. Okay. Some children, look at this one, said skip crawling and goes right to walk. That's fine. Other children can't do that. And it's okay. That's their developmental pace. And the sensitive period is the time where they start to learn things like language and movement. And, it is a time where they're great psychological development. Fontanelles, these are those little soft spots in the heads. We have anterior and posterior. Posterior should close about 6 to 8 weeks, okay? The anterior about 12 to 18 months. Well, what if the anterior closes too quickly? That's a big, soft spot in the middle of the head. Well, how's the brain going to grow? So it's important that we check those things. Or if it's wide open at 2 years old, why is it wide open? Is there too much pressure in the head? Is there hydrocephalus? Is there a brain tumor? So it's important to know when these close and to check for it. Now there's something called binocularity. When children are born, each eye works separately. This eye sees this way and this one's this way. If we're adults, we could take and point a finger and both of our eyes will go to that finger. Infants aren't like that at birth. It starts coming together about 4 months. And that actually starts the depth perception. They're able to figure out that toy and grab it instead of searching for it with one eye or the other eye, okay? Pain. Now, we've talked about pain. You've seen my cahoots. We know that there's flack for infants. Faces starts at preschool, but pain in general, what do you see? Well, I think the one thing is that you see them, they're inconsolable, crying, grimacing, eyes closed. When you get those fists closed and their legs are moving up and down, something's happening. If you see a kid stuck in their head to the right, it could be the location of that pain. Maybe they have an earache. Ear infections hurt. SIDS. SIDS is one of those things that we have really stopped the amount of SIDS death that they used to have. SIDS, we know risk factors. Number one, it's back to sleep all the time because we feel it's the safest way for a child to sleep. Now, we know that if a bed is full of all different toys and blankets and stuff, and they get overheated, oh my goodness, yes, that is one of the things that can happen. So clean beds, hard mattress, and do not overdress the baby. If there's smoking in the house, that secondhand smoke is not good. Of course, little or no prenatal care. What if that kid had just been sick with a little runny nose? That is one of them. Younger women who have babies, premature, and that's male infants. Males are more than females with SIDS deaths. And actually breastfeeding, they say, decreases the amount of SIDS death. So formula-fed infants are more risk. Infants' reflexes, they have got a bunch. We have the moral, we have the suck, we have the rooting, grasp, step, and Babinski. So these things, let me go back to that one. So the reflexes, moral is when you startle a baby. It's a similar name. You could either call startle or you could call it moral. It's when they hear loud noise or you knock their crib and they hands up and feet go up. And that's the startle grip. The grasp is that voluntary or that reflex grasp. The step is you put them sitting up, they're going to try to walk. And then Babinski is just like adults, stroke the bottom of their heel. Now, infants from 6 to 9 months, when they're going to fall, they put their arms and their legs out. This is a reflex that happens. So most children can protect themselves. Now, of course, if you were a cerebral palsy child, no, you cannot. But they always, even as adults, we will put our hands out if we're about to fall. Again, children who put their hands out usually going to break some wrists at one point in their life because that's just what they do. So here is a great timeline of gross motor. Remember, gross is G, get up and go, go, go. So it's anything with movement. Okay, so you hold your head up and then you start to sit with support. You talk tummy to back, back to tummy, and then 6 to 8 months, but the book says 8 months, sitting without support, pulling themselves up in a standing position. That's at 9 months, starting to crawl, walk, stands, and then walks. And this is all your get up and go, go, go for your infants. Now, toddlers, ages 1 to 3. This is what I call my dive bomb group because there's absolutely no fear in these children. Now, when you go into a toddler's room, yes, you're going to show them the equipment and blah, 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 but don't go in there and start showing them that stuff first. First of all, you're going to create a rapport. Creating the rapport is the best thing. And it could be, depending on the age, show them a sticker you have, or tell them, oh, you've got such beautiful eyes. Oh, you've got a Batman shirt on. Oh, I love Batman. You know, do something, sit next to them, maybe peekaboo with them, something, depending on the age, getting them to warm up to you. Then you can start showing them the equipment, having them touch it, feel it. Sitting in mom's or dad's or caregiver's lap, absolutely the most perfect thing to do because now they're secure, okay? Again, using play, having, the toddler, ask them where their ears are, and then you can look at the ears and where's your nose, and you can look at a nose and the mouth, and they start to play and they enjoy that. Pain, toddlers. So again, you're going to see a toddler in pain. Sometimes you're going to see them just sit in the corner, not want to play. I think the one thing that's evident is they're not going to want to eat at all. Okay. When a kid doesn't want to eat, something is happening. And then of course you have the toddler in severe pain, and that's the one that no matter what, you cannot comfort that child. Remember, toddlers are on the face, the FLAC pain scale. Faces does not start till preschool. So FLAC, what does it measure? Well, it looks at the face. Is that quivering jaw, the chin? And L, it's the legs. Are they, going up and down because I hurt? A is, are they arched? Are they rigid? What's going on? C, are they crying? No crying? Or C, are they happy and just laying there? So this is how we add up the scale and look at how much pain we are in over these children. And it works really well on these younger children, infants and toddlers. You can use these on nonverbal children too. We use these on some of the nonverbal cerebral palsy children, and it works for them also. Now, at 1 year old, you should switch your child to whole milk. Now, whole milk does not have iron in it, and it doesn't have things, but it has vitamin D. Vitamin D is good for muscles and joint growth. So at 1 year old, switch them to whole milk, not skim milk. At 2%, they need the fat. So give them whole milk. And now preschoolers, ages 3 to 5. Kohlberg. Well, again, Kohlberg, they start to feel the morality, as in they know when they've done right, they know when they've done wrong. And again, this is good and bad, the consequence for each, but now they're really understanding it, and they're feeling it, not just understanding. They're feeling, oh, I did that bad, I shouldn't have done that. I had my grandson tell me at dinner one night, I'm sorry, Nana, I drew on your wall outside. And I hadn't even seen it yet, but he felt, that he needed to tell me. And I think he was 4 years old or 3 years old when that happened. So it was right into Kohlberg. We know that child of this age, 3 to 5, they're starting to see when mommy don't feel good or is laying down, or, I would put an ice bag. Sometimes my knee would hurt really bad, and he would come over and hug it and kiss it for me and tell me all better. They're starting to have that empathy towards you and for you to feel good. Now, toddlers, I can't tell you how many Band-Aids I have in my house. I can't tell you how many character cartoons are in there. And I can't tell you how many this child has used in the last couple of years, but a Band-Aid cures everything. One of the things with this age group, they feel that if they're cut and they're bleeding, that all their blood's going to come out. They don't understand it's going to stop. But put a Band-Aid on it and it stops it, and they're all better. Okay. And just like this picture of this girl has how many Band-Aids on, she's probably happier now because now she knows she's safe. Nothing is going to leak. Again, pain scale for preschoolers is going to be your faces now. They can look at this little scale and point to it and use it extremely accurately. When we get to the point of numeric, this child's not going to be up to 8 years old then, okay? So gross motor skills, get up and go, go, go for your 3 to 5 years old. Well, at age 3, they should be able to walk on a line or a balance beam. They can skip, they can gallop, they can walk. They can usually use a tricycle. They can catch a ball and jump with 2 feet. Now, 4 to 5, you can stand on 1 foot. I know my little grandson tried earlier and he kept falling over, but now picks his foot up and now he can hop on 1 foot. So he thinks that's pretty cool. They can stand on their tippy toes, they can jump far, they can jump into a step over a hurdle, and they can alternate directions when they're running, and they do really well. So that is gross motor skills. It's all about movement. Now, fine motor skills, ages 3 to 5. So one of the things that we do to get children ready for school is that they need some social maturity. So getting those children involved with other children, getting them together to be able to have other kids around, and that's okay. I mean, some children, take that adjustment to share and to follow other children and, be able to still do their work. Now, parents, when we're sending a child to school, should say that they love school and that school is great and you're going to learn so much and they're so excited for you. And, as they're in school, what did you do today? Oh my goodness, that's such good work. Doesn't matter if they're colored out the lines and whatever. Oh, this is good. Do you like it? Yes. Okay. Wow. Let's post this up. That's why their refrigerator gets so full. Reading to children is invaluable. So now that you started them, reading, now they're into the letters. Okay. Again, that social emotional growth, I said, putting them in, ballerinas or gymnastics or sports things or something, or they're with other children, so important. And, they need to be able to run and jump and, color. So doing these things and encouraging it is so important. And as a preschooler, they're starting to be able to express themselves more in a full language, in a full sentence. So school age children, when they get to school age, it starts with the age of obesity problems. Children tend to overeat at school age. Younger kids don't. They're too busy. They don't have time to eat. You have to stop most of them. But school age children now, you're going to see them get a little bit pudgier. So why is this happening? Well, it's becoming an increasing epidemic in this country. It is because children are into video games, they're into TV, and they're not getting out and running around because there's other things to occupy their time. This wasn't many years ago. We barely had programs for kids in the morning, and on Saturday, there wasn't all day long like there is today. So we were out in the backyard, playing all the time, but it's changed today. It's completely changed. So we need to encourage that. Also, teaching good nutrition before birth should be done, should be eating well as a pregnant woman, and they're born. Children, infants need to be proper nutrition. Again, nutrition, 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 nutrition. Now, if you have a child who is school age, who is overweight and obese, they do have increased risk for these, what we call cardiometabolic changes. Hypertension and hypercholesterolemia and diabetes can occur with these children later on in life when they're heavier as school age children. So School-age children are a great group to start teaching. We can teach them programs. There are the programs about Dare to keep kids off drugs. And now we're doing them also on nutrition. We're using things like My Plate, a computer program about what to eat and how to eat, and to try to let them know what the risks are from that. So obesity, it's not any race, it's not any culture, it's across the board, it's all of us, you know. But as parents, we need to teach that they can teach them how to eat properly from an early age, and that will help prevent those children becoming obese and to avoid those complications. One of the things that we've done as younger in their age, made them finish their plate at food, right? So you're eating dinner and they don't finish their plate, you're not getting up till it's finished, right? Well, school-age children, it's something you shouldn't do. So if they're done eating, are you done? Are you've had enough? Remember, there's no dessert. Okay, I'm full. All right, do not make them finish their plate. So school-age children, we know it's same-sex peer and acceptance is important. Children that are in school age with their peers, they are going to probably do the same sports, the same clubs, the same things. Whether they wanted to do something else, it didn't matter, because they want to be with their buddy, their peer. They want to be with that person. Talking to a child for procedures, well, again, depends on their developmental ages, right? If they're a very young child, you know, let's say that young school age at ages 5 or 6, you know, they're going to go in to get an x-ray. They broke their arm, we're going to do an x-ray or do a chest x-ray, doesn't matter. They're going to see this big machine that's with this noise, it's look, look, look over their head, and this big hard table, and they're going to be scared. What would you say? Well, tell them it's a big camera. It's going to take a picture of all the insides of you. And I always would show these children the picture. They could see the broken bone, or they could see their chest, or whatever I was taking that picture of. And I'm telling you, I've probably stopped a lot of fears of a lot of children with future x-rays because I've done it that way. And the kids are happy. You don't want a kid happy, screaming, running, because then putting the cast on is going to be a problem because they're not going to trust you. So communicating in a language on their level, letting them know what's going to happen is important. Just do not tell them it's not going to hurt. They don't understand that. How do you assess that hypoglossal nerve, cranial nerve 9? Stick their tongue out, and you can see babies do it too. Lymph node tissue, you know, when you're sick, you get big swollen lymph glands. Children do not have them unless they are sick. We know the lymph system has to do with having an immune system and being protected. We know at birth they have mom, but then it wears off and they have to build their own. And that's through immunizations, and that's through getting their own illnesses. And then you're going to have all those antibodies in your body. So lymph nodes, you're not going to see them unless they're sick. Dental health, children of all ages, infants, all of them need to brush their teeth as soon as there's a tooth in. I mean, an infant, you can take a warm, wet washcloth, that can work. You don't need a toothbrush, but you need to brush their teeth. When they get into school age, they do need to brush their teeth, a minimum of brushing them morning and night. Now, flossing would be ideal, but remember, children at age 5 to 7 don't have that manual dexterity to be able to floss properly. So a 1-year-old, one first grader, we are going to say, okay, please brush your teeth. That's all you need to do. Now, adolescence. Leading cause of death in adolescence is unintentional injuries, which is a car crash. Then it's followed by suicide and homicide. Now, why are they committing suicide? Adolescents, they're searching for their identity, according to Erikson. They don't know who they are, and they get severely depressed. They have intense feelings of loneliness, and they're all alone. Nobody understands. And sometimes with ridicule and, you know, those things that go on, they can commit suicide. And homicide is firearms out. They says, well, I'm old enough now, I'm going to touch them, and we know sometimes they can go off. Sense of identity. I've talked with adolescents. Remember, these children are looking for who they are. So they're testing boundaries like crazy. So what do we need to do? We need to set limits and structures. We know that they're fighting for independence and control over that environment, especially those 15 to 17-year-olds. So we just need to sit down with them and make a plan which will work for both of you. So how are you as a nurse going to be able to talk to an adolescent? They don't want to talk to their parents. They don't like adults, most of them. So now you're an adult going in there to talk with them. How are you going to do? Well, first of all, you're not going to go in and ask them a question that you need to know for, their condition. You're going to say, hey, so tell me, what do you do for fun? What music do you listen to? Have you decided on a college yet? Start this open, broad conversation, and then they're going to get a little bit of interest in you because maybe you know what their music are and you talk about it and they're like, wow, I guess this nurse is pretty cool. Then how do you talk about sex? Well, most adolescents will not talk about sex in front of their parents. Have the parents leave the room. Now, you'll sit there, talk, find out whatever the adolescent will share. Remember to listen, give them time to express themselves so that you can understand what they're talking about. Don't assume you know what they're trying to tell you. Listen first. You do not have to tell the parents unless it's something that will hurt themselves or hurt somebody else. So again, just what I just said, build up that confidentiality, that therapeutic relationship, and get that information. And it takes time to build up respect and that openness with adolescent, but it can happen pretty quickly if you start out with just talking about other stuff. Sleep and adolescents, they should be getting a lot of sleep. They should sleep as much as infants, but they do not. No adolescent sleeps that much. And why? They're too busy with social obligations and schoolwork. They're trying to get into best college, and they don't want to miss anything that's going on in the world with their friends and them. So they're not sleeping properly, staying up all night to do homework because they had to go to this event first, but they got to get it done because they need to get their A because they need to get in their college. So there is sleep deprivation with adolescents. Now, Tanner stages of development is very, very important. Knowing that it starts with 1, which is the first stage, you see a little bit of nothing going on. And then 2, little breast buds is the first thing that happens with girls. Boys, the testicles enlarge. And then as they go into puberty, you're going to see them going into the mature male and the mature female. So knowing the stages is an important thing. So you're going to have 5 basic dosage calculation problems. Again, if you go to my YouTube page, you're going to see the dosage calculation video. In fact, what I guess I'll do is I'm going to get that link, put it on the announcement with this link so that you can go back and look. Again, if you need the worksheets that are, go with it, send me a message, bbogart@fortiscollege.edu, or I think you can get me through Canvas. Send me a message, I'll send them to you. Yes, I'm on vacation, but I am checking my emails morning and night. So I'm still here for you. And I wish you all to do really good on that first exam because we've worked really hard for you. Okay? Any questions? Thanks for being patient with my outage. It's just about had a severe thunderstorm right now. So I guess I have to wait a little bit to go to the pool or to the beach. Bye, guys. Thank you.
Bye. Thank you for your time.
Y'all. Oh, my pleasure.
Professor Boga, I had a question. Can we use the Kahoot for week 1 to 3 to the as an extra result for exam?
You absolutely should review the Kahoots. Is that what you're asking?
Yes, ma'am.
Oh my goodness, that's why it should be posted on your announcements.
Okay, thank you.
Because these are concepts you will see in exams, HESI, and NCLEX. These are invaluable. I change them every semester according to what I see the results of your HESIs are. So I'm constantly changing, adding things to try to help you get even better scores than you've been getting, okay? So yes, please use them. Great, great question.
have a
Use your
question.
study guide and use your Kahoots. Yes.
Have you posted the Kahoots on the announcement though?
Yes, I have already. 1, 2, and 3.
All right, thank you.
And they're always there every week for you too, Yagana.
All right, thank you.
Okay, but I'm going to make an announcement with reviews. I'm going to put the 3 Kahoots in my recording. I'm going to keep editing it and putting the other persons in there. So you only have one place to look. Okay.
Thank you.
All right, guys. Thank you so much. Appreciate y'all.